So first off, really would like to welcome our panelists today. Really wanted to welcome David. David is our Associate Director of Research at the Centre for Mental Health, and David will be sharing the main findings of the report and discussing the evaluation of these. And then after David's presentation, we will be inviting the panelists today. So the panelists that we have are Jeanette Bain-Burnett, who's the Executive Director of Policy and Integrity of Sport England. And Jeanette will be giving an introduction to herself. Hi, Jeanette.
Hi, everyone. It's really great to be here. I'm here representing Sport England as we're one of the funders that has been involved in this work over the past few years. We're really excited to see the result of some of the work that has been happening in various local areas, and I'll be sharing some of our learning and next steps. So look forward to being a part of the conversation.
Thank you, Jeanette. And then our other panelist today is Brian Dow, Deputy Chief Exec of Rethink Mental Illness. Brian, would you like to introduce yourself?
Hi, Julie, and hi, everyone else. Yeah, it's really lovely to be here. As I'm sure I'll say later on, physical activity is a really important part in the recovery journey for people with severe mental illness. We've worked with Sport England for a number of years now, and a really big campaign across, not just with ourselves, but with other colleagues in the Richmond group, of which I'm sure I'll say a little bit more. So it's great to be here to hear the findings of the report, to think about how we commit ourselves to putting those into practice. So nice to see you all.
Thank you, Brian. And we would just like to acknowledge that we had invited experts by experience to the webinar, and we saw their role as being absolutely fundamental to the work. But due to some practical challenges and due to holiday season, we've been unable to secure somebody on the panel today. However, we would really welcome your thoughts and comments in the chat if you have been part of the activity at all. Without further ado, I would like to hand over to my wonderful colleague David to introduce and present the findings. Thank you, David.
Thank you, Julie. Good morning, everybody. Yeah, again, I'm David. I work at Centre for Mental Health, and I've been involved with this piece of research, this independent evaluation and collection of learning and insights on this initiative, and it's been a great pleasure to do so. However, it would be wrong for me to claim that I did the lion's share of the work that was undertaken by our researchers, Julia Doyle, Zoe McHale, and Katie Yao. And Andy Bell, our chief exec, was also involved, which is a sign really of how important we think this work is, that he also was part of the research team on this occasion. Can I have the next slide, please? So Centre for Mental Health, so you may not know who we are. We are an independent charity. We are very much focused on addressing injustices in mental health, on promoting equity and equality. And our primary purpose is to build a research base in terms of, to support the creation of fairer mental health systems, policies and practice. Next slide, please. So I'm going to give you the 4 key things which you will see will structure the presentation, but I didn't think there was any point in keeping it secret to the end. These are the 4 key messages that we'd like you to take away. First and foremost, our research confirmed, as I'm sure everybody here knows, that physical activity can transform lives, especially or including for those with severe mental health challenges, but access isn't equal. And it's that issue of equality and equity that really did structure the evaluation, and indeed is so strong in the findings that we found. So this is about sport and physical activity. It's about all the benefits that those activities bring, but it's also about justice. Very clearly, it's about the inequity. It's about the systemic challenges, the preventable and unnecessary and unjust differences across the system that people with severe mental health problems experience, and indeed what our evaluation focuses on what the two sites that I'll talk about in a moment did in order to address those injustices, those differences. A key message for us is that tailored system change is possible, and we're saying tailored because the place-based nature of this work is important, that whilst there are some principles that we can draw out and actually are probably widely applicable, that I think what we learned very clearly was that it's very much about the local differences, the local specificities of a place that actually is part and parcel of how you address system change, which is possible. And indeed, we showed that sometimes the smallest of changes actually had significant impacts. And really, just to reiterate what Julie was saying, is that it's really clear. It's really clear if you take a step back from this project and look, that actually where lived experience leads, real change can follow. Next slide, please. So just a quick canter through the literature. The reason you'll be very familiar with this, I'm sure, but we know that people with severe mental illness are likely to die between 15 and 20 years earlier than other people in our society. That is a huge inequality, a very stark inequality. That poor physical health is a major cause of those inequalities, and obviously physical activity is a key factor in improving our physical health. But also, not only does it close the health gap, but we know that engagement with physical activity and sport also offers things like dignity and connection and joy, all of which are really important outcomes for all of us, but not least for people who find themselves marginalised and excluded, of which people with severe and enduring mental health problems are a key element. Next slide, please. So the projects, as they were, these were projects that aim to address those systemic barriers to be able to change the way in which services are delivered, in which interactions are undertaken, in which people are empowered and supported and confident to be able to access services. And that these initiatives took place in two places, one being Tower Hamlets, the London Borough in the east of London, and the other being in North East Lincolnshire. As you already know, because Jeanette and Brian you've just heard from them, but it was funded by Sport England, and indeed the projects themselves were led by Rethink Mental Illness. And we were pleased to work with them because prior to this, we did a piece of evaluation on another piece of work that Rethink Mental Illness led, which was around building mental health alliances, building collaborations locally between voluntary sector organisations so that they were able to take an active part as a sector in mental health transformation, and that we outlined our findings there in a report called More Than the Sum of Our Parts. And why it was important for us was that Tower Hamlets and North East Lincolnshire were two of the key sites for that piece of evaluation as well. So if you're interested in some of the contextual ideas, I would also point you to that report that is on our website. And the focus of these projects, as I said, was very much about understanding barriers, about building inclusive activities, about testing new approaches, and working really closely, cheek by jowl, with people with direct lived experience in both places, and in Tower Hamlets, working with carers of people who had direct lived experience of poor mental health. Next slide, please. Just to give you the slightest kind of insight, just to give you some of the background as to why these two places it was interesting researching interventions in these two places because they are so different. Tower Hamlets in East London has a population officially of about 310,000. 53% of the residents were born in the UK, which means that 47% of them aren't. So it's a very diverse, very rich ethnic diversity in the area, but also obviously brings with it a lot of challenges that we know that marginalised and racialised communities face, and that Tower Hamlets has one of the highest rates of premature mortality amongst adults with severe mental illness, 147 deaths per 100,000. That's the rate compared to the England average of 104. So that's the kind of context in which we're working in Tower Hamlets. Can I have the next slide, please? And the context in North East Lincolnshire was very different, but nonetheless also really striking. It's a much smaller population, about 160,000, but 95% of the residents were white British. And also we know that a high proportion of adults live in rural or coastal communities, very different to Tower Hamlets, but also that rates of depression and anxiety and suicide in North East Links are significantly above national averages, which obviously is a really important piece of information when we're thinking about understanding not only what the intervention should be, but also how we as evaluators, our kind of perspective on the problem and the questions that we asked of it. The next slide, please. So the research, the overarching research question that you will find in the report and that we address in some detail is how can we improve access to physical activity for people living with severe mental illness, especially those who face the greatest barriers, within the context of looking very closely at the interventions that were operationalised, that were executed in Tower Hamlets and North East Lincolnshire. I'm seeing messages come up. Is there a problem with the sound? No? Is it okay, Julie?
I think it's just an isolated problem, David. As far as I know, everyone else is able to hear.
Okay, thank you. Can we go to the next, back to the, okay, so that's the next, and again, the next slide. And again, the next slide. Okay, so how we did the research? It was a mixed methods approach. We worked with, we did a survey of people with lived experience in both of those areas. There were 32 respondents in total, quite in depth, quite qualitative, quite useful and nuanced and detailed information was gathered there. We also did a literature review looking at existing evidence on this topic. There were then a number of interviews which were undertaken in focus groups, and 13 people participated there. And we then did additional interviews and with project members and other experts by experience and local stakeholders, notably people who worked in the voluntary sector and also in the health sector. And then there were a number of system mapping workshops, which were very interesting, where stakeholders sat together and tried to visualize and to represent what the journey was for people with lived experience of mental health from their homes into actually getting some support to be able to access physical activity. And there was an ongoing kind of process. We worked very closely with the project team where we reviewed their materials and what they were producing and talking to them in great depth throughout. Next slide, please. So what did we find? So this is where this is where we get into the findings. So yes, all the things that we think we know about physical activity was confirmed by the people that we were working with, was confirmed by the people with experts, the experts by experience, by those who were carers and by others, that when they were able to engage in physical activity, there were positive impacts on their mood and confidence, on their sense of social connection as a kind of antidote to loneliness and exclusion, on their physical health, clearly, but also on a kind of sense of autonomy and belonging, of being part of a set of activities that gave structure and purpose and some kind of, supported them in realizing their potential. As one person said, I'd forgotten what it was like to laugh with people while moving. It wasn't therapy, it was something better. Next slide, please. But there were barriers to participation. And what's really important is that these barriers are numerous, and they aren't just personal. I think this was a really important tenet of the whole intervention, was that supporting individuals, of course, is important. This is about individuals being able to engage and be able to improve their own mental health and well-being. But actually, the barriers, whilst they were felt acutely by individuals, their genesis, they were systemic. So the first thing that people talked about, as we might expect, is about stigma and anxiety. We know about stigma and its kind of close personal friend shame. We know how that affects people, how people feel ashamed about their bodies, people feel ashamed about their mental illness, people feel ashamed about their abilities, and that often got in the way And the thing about stigma, as we know, is that it kind of exists outside of us, but gets deep into us. And so that related to anxiety. So the actual, so those kind of psychosocial factors of stigma and anxiety were key to understand, and also to think about how systemically we might address them. There were also issues around medication effects, that sometimes the medicines that people were taking meant that their ability to participate was affected. There was a real thing about a lack of safe, welcoming spaces. Safe both in terms of physically safe, where people felt as though that they were in some way at risk of physical effects, but also a kind of psychological safety that people felt were lacking in these, especially in leisure centres, that this kind of the idea of what a leisure centre is and what you have to be able to get through the door and how you have to behave in order to be accepted, it felt very unsettling for people. There were also material challenges that people face, not least financial and transport challenges in a place like North East Links, where, if you know, with dispersed communities across a rather large kind of patch, that actually transport was clearly an issue, and that also in London, where transport seems to be much more accessible, it is nonetheless financially. There's a financial hit there. So there were those very material, very practical challenges that people faced. And there were a number of cultural and gender-specific needs as well, not least in Tower Hamlets, given what we know about the diversity of their population, that actually there's the operations of those forces that we know, those factors that make it difficult for people from racialized communities to access mainstream services on occasion, but also gender-specific needs for things like women-only spaces and an assurance that those needs would be honoured. And the quote, it's not just that it's not that we don't want to exercise, it's that the world isn't built for us to feel welcome doing it. Next slide, please. I pulled out this quote because this is in the report, and I think it's very powerful. I think it captures a lot of those issues, that nexus of issues around mental illness, around gender, and around exclusion based on race. When this participant noted, as a Muslim woman, I naturally feel more comfortable in a women's setting, but also I feel if I get myself more used to mixed environments, I'll be okay eventually with it. The women's space at the gym is not as good as the mixed one, limited resources. Then there is the body confidence issues, lack of knowledge about the activities, sport, gym equipment. Next slide, please. So what helped people get involved? I mean, the absolute crux of this is it was around trust and safety, about those kind of interpersonal feelings, about trusting a system, about feeling as though that they would be kept safe and that they wouldn't be led to feel excluded once they got there, and that their participation would be valued and recognised. So the things that the headlines that were coming out from what people were telling us is that they really valued peer support and those trusted relationships, people that they felt that they could be themselves with, that got them, that understood some of the issues that they were facing. Trauma-informed staff training, that people, you know, that, I mean, I think what's becoming more and more apparent, isn't it, in this work, is that if you work on environments that are making them trauma informed, that approach to work benefits everybody, even those people that actually have not necessarily experienced trauma. It is just good to have an inclusive, psychologically aware environment for places where people are potentially making themselves very vulnerable, both physically and emotionally. And for people with severe mental health problems, that obviously is absolutely critical. Those people very often were arriving with histories of trauma before they got into those services, and the very least that we should be able to do is ensure that their experience of those services that are there to help them get better are not going to be traumatizing for them themselves. Obviously, just picking up again from that quote and from other points made, that women only and culturally sensitive sessions worked, that they were well received. and the care involvement. I think one of the things that really struck me from this was that, especially in Tower Hamlets, that through the co-production process, this focus on carers as being absolutely key to being able to support people with direct experience of poor mental health, as well as carers either together as a unit or indeed separately, that support could be offered, was absolutely critical. And again, just a quick quote: knowing someone that would meet me there and that they understood made all the difference. Next page, please. Co-production. I just want to say here that it was very clear from the get-go, working with Jason, who's the lead on the project from the first breath of this, was that at its very heart was co-production, about not making any assumptions about what the actual services would be, what the interventions would be, or how they would be delivered. But that kind of early doors, really, blank sheet of paper, co-production strengthened this. Although we have to acknowledge, if you do that properly, as indeed Jason was very focused on doing, it isn't often the fastest of processes. That takes time and energy and effort. But just to say that, so that experts by experience design these activities from the get-go, that helped build trust and challenge some of the power dynamics that are inherent in services that are provided by statutory organisations in particular, and created a kind of sense of ownership and relevance. Next slide, please. So the local success stories that we talk about in more detail in the report, and I would encourage you to look at them and think about the learning that could be relevant to you in your areas, were swim together sessions in Lincolnshire, a relatively small kind of intervention, but nonetheless was warmly welcomed, and that is people facing all that swimming is, all that entails, the kind of vulnerability of swimming, all that stuff that people encounter when they're getting over those initial hurdles. Actually, when they were supported as they were in Lincolnshire, that was very welcome. That there were events built around Mental Health Awareness Week. It's good to have a focus. It's good to be able to have a suite of activities that people can dip in and out of, and actually in a way that people felt as though they were, that their needs were being acknowledged, but they weren't necessarily being individually kind of focused, or that they could be part of an event, as opposed to pitching up themselves, making an independent kind of claim or request, which in itself can make people feel vulnerable. Carers, especially in Tower Hamlets, the carers that were trained to be health influencers, and I'll talk a little bit more in a moment about what health influencers are. I think this is one of the key bits of innovation in this project that I would encourage people to look at and think about the applicability. And finally, was working with people in leisure centres to get them to understand better, to improve their understanding of what mental illness is and what people with severe mental health challenges might need, and how to build an inclusive environment in order to meet their needs. Next slide, please. So a care influence, I've lifted this from the report, is a care or support worker who encourages and enables someone with severe mental illness to take part in physical activity, often by offering emotional support, practical help and trusted companionship. And the little quote here is, "She didn't push me, she just kept showing up, reminding me I could do it. That's why I went." Next slide, please. What did professionals tell us on that piece around building their capacity and their capability? Was that they too knew that they needed to be more confident in addressing these issues around physical activity and mental illness. I suppose it's the flip side of the stigma point, is that they didn't often know how to raise the issue, how to talk about it. They weren't confident of their language. They weren't confident of what they knew, and that anything that addressed that actually was welcome as part of that opening up, as part of improving the accessibility of services. They said it was hard to keep up with local options. It's sometimes quite difficult to know what's going on in a local area, especially ones as fast-paced and as diverse as Tower Hamlets and also North East Links. And they wanted practical trauma-informed tools. They really wanted to be helped to be able to change their practice, to adapt what they did in order to honour this lived experience and to act upon it. Next slide, please. So what needs to change? I've said here, we need joined up thinking and joined up action, and that's where we had these moments of success in Tower Hamlets and North East Lincolnshire, was where the people were thinking together and acting together. that it's an acknowledgement that I think we need to acknowledge that systemic barriers require systemic solutions, and as long as we keep focusing on supporting individuals to manage systemic solutions, we're not going to create that sustained change. And that those changes don't have to be, just because you're thinking system wide, it doesn't mean that the individual changes themselves have to be huge. Sometimes small changes can have big system impacts, but it's about making sure that you're thinking in a kind of more sustained long-term way. Obviously, short-term funding limits long-term impact, and that once all the goodwill is built and all the expertise is built up, that it's important that we find ways to keep that going, to keep it sustained, and to build expertise. Services must collaborate and not compete, which is very much a policy direction of this government, as we know. Although actually making that real is fraught with challenges, as I'm sure people in this room will be able to attest and be able to help us think through. And that really it's a question around leadership, about signing up properly to co-production, not just for it to be a tick box exercise, but really dismantling the way in which we think about where the good ideas come from, how they can be built, and how they can be operationalized. Next slide, please. 2 key recommendations from the report. I'll just read them out as they are. Number 1, organisations and partnerships should work alongside individuals and communities to develop strategies. That's very much the co-production piece. And secondly, and that charities and funders should commit to working in place-based partnerships, but doing so for the long term, the long haul. And then, and then I've just got one final, there we go. And so the recommendations, I kind of simplified them, and I've simplified them to this, which are, we need to move from good intentions to real change, and we've seen the real kind of possibility and potential of that, and what that yields in North East Links and Tower Hamlets on this initiative. But we've got to work with communities, not just for them. We need long-term place-based partnerships. We need to embed physical activity and mental health support more broadly. And perhaps crucially of all, we need to make inclusion the starting point, not the afterthought. Thank you.
Thank you, David. Thank you for the presentation. For those of you that joined once the presentation had started, that was my colleague David Woodhead, who's our Associate Director for Research, sharing the findings of the report. Really great to see some of your comments in the chat, really endorsing some of the findings around the importance of transport, cultural sensitivity, learning lessons from the report as well, and the importance of collaboration. So thank you for your comments in the chat so far. I think we're about to open the Q&A chat. So if you do have any questions, please pop your questions in the Q&A. And I'd now like to bring back in our first panellist, Jeanette Bain-Burnett, just to give some initial responses to David's presentation. And perhaps for those that have just joined, if you wouldn't mind just reaffirming your role, that would be really helpful. Thank you, Jeanette.
Sure, no problem, Julie, and thanks, David. That was a really concise and concise yet comprehensive presentation of what I know has been quite an expansive programme. So for us at Sport England, our strategy is really squarely focused on tackling inequalities, and it was really good to hear at the very beginning of the presentation the reasons that Rethink Mental Illness decided to focus on physical activity, the understanding that there is sustained inequity in access for people who have serious mental health conditions in getting active, and that those are complex and varied. And that's actually the reason that we wanted to get involved in funding this work, because we recognize that you can't kind of stand or sit at a bit of a bird's eye view and deal with these challenges that individuals, depending on the kind of compounding inequalities or inequities that they face, will have a whole range of barriers. And the barriers are not always the barriers that you expect them to be. So whereas we often think about barriers in the context of, just specific services or, access to a venue, that kind of thing. There's so many varied barriers, and I think the thing that really strikes me is the focus on collaboration across lots of different areas of policy and practice. Because, for example, thinking about the connection to transport, quite often you wouldn't make that as a quick and direct connection around someone with a mental health challenge. Um, and so just thinking about from the perspective of providers, thinking from a perspective of charities and local authorities, I think one of the key learnings here is that need to be more joined up in our approach and to think about the user journey. So I think the other thing for me that really struck me was the mapping of an individual user's journey and how important that is for people who have that direct experience. So for us at Sport England, we have since 2020, we've been developing and implementing a strategy called Uniting the Movement. As I said, it's all about tackling inequalities. And one of the areas of focus for us in terms of policy has been connecting with health and well-being. So how do we create stronger connections between our sector, sport, physical activity, kind of more broadly, traditional providers of physical activity, but also recognizing that there are other partners that are able to contribute to people, the offer of physical activity. How do we connect to that broader offer with other sectors, with other policy areas? So health and well-being is one of the key policy areas. And when we kind of developed our theory of change around how we would connect, we recognized mental health as a key area. We surveyed some of the obviously some of the statistics that David went through in terms of the levels of exclusion and the low levels of physical activity, but also recognizing that the NHS had this as one of their priorities in their sort of national and local strategies. So we thought it would be probably would be remiss of us not to recognize and to invest and to kind of connect in a meaningful way with this area. More broadly, thinking about health and other long-term conditions, which obviously mental health fits into, we developed a partnership with the Richmond group of charities, and Rethink is a part of that group of charities, to think about what the common barriers are, the kind of shared challenges for people living with long-term health conditions or at risk of those conditions. So we've been doing this work over a number of years. It's of real interest to us. We are excited to see some of the concrete stuff that's coming out of it. And I think the other thing I should mention is We Are Undefeatable, which is the campaign which has come out of our partnership with the Richmond Group of Charities, which essentially looks to challenge perceptions about the limitations on people with long-term health conditions and their ability to engage in physical activity, and also the access that they have. So it's kind of demand and supply side. So yeah, lots going on from our side. We're really excited, but I'll probably leave it at that and hand over to Brian.
Thank you, Jeanette. Some really insightful comments and thoughts there. So let's hand over to Brian, if you wouldn't mind just introducing yourself for people that have just joined and just a little bit about your initial responses to the presentation. Thank you, Brian.
Yeah, thanks, Julie. And Jeanette's always a hard act to follow. But so my name is Brian Dow. I'm Deputy Chief Executive of Rethink Mental Illness and also Chief Executive of Mental Health UK. It's really interesting just hearing David's reflections from the report, because I think firstly so much of that is familiar, because for myself, I've been in this role for about 11 years nearly. That went past quickly, but also I think it's the stuff that's actually not so familiar or not so obvious that's really important. And I suppose the point about a barrier is that it's invisible for half of the people on the other side, isn't it? Because as my colleague James likes to say, the world is made by extroverts for extroverts. And I think those kind of design principles that are sometimes at play in the physical activity arena, and particularly in the sport arena, even though we've seen massive advances in terms of the Paralympics and disability sport, and that's incredibly positive. I think sometimes on the ground for people, the ordinary day-to-day experience that they encounter is still filled with lots of barriers. So, this work has been very important for us, and I think it's really good to see it elucidated like this. I took probably three other reflections from me arising from the report. The first is, this might sound like a really technical thing, but I remember a discussion with our board of trustees about 10 years ago, where we talked about the question of who we were for. And the discussion was basically, are we here for people with severe mental illness? So diagnosed conditions like you saw at the start, bipolar disorder, schizophrenia. Rethink initially started life as the National Schizophrenia Fellowship. Or were we here for something slightly, subtly different, but actually therefore very much more expansive, which was to say people who are severely affected by mental illness? And we very much see ourselves in that second terrain. So what that really means, I suppose, is that it recognizes the reality that if you have a diagnosed condition, or in fact you're living with a condition and you haven't been diagnosed, because lots of conditions, it takes a very long time to be diagnosed, then obviously the most important thing that will generally happen in your life is access to good quality care quickly and close to home. But if actually lots of other things are going wrong in your life, so let's say you are falling out of employment, so you're therefore running into debt, you're becoming isolated, and almost certainly your physical health is beginning to suffer from that, various other things are happening, then inevitably you'll become much more severely affected by that mental illness. And to that extent, physical activity has always been a pillar in our communities that care principle, which is to say, let's try to help people with all of the complexities in their life. So that's why I work with Sport England, and on Jeanette for a few years, been working with the team for a long time, has been so incredibly important for us because it's allowed us to elevate that. And just to really quickly endorse what Jeanette said about We Are Undefeatable, I think that's been an incredibly important campaign because I think it's managed to do something quite unusual, which is, and I see this both at a professional level and at an anecdotal level, where people now understand better that when you have a physical or a mental health condition, that physical activity, as long as it's the right kind of thing, right kind of activity, is good for you. And engaging in physical activity is good for you. And that undefeatable component, I think, has been really helpful. The second thing I would just say very quickly is in terms of place. I completely agree with that finding that the whole point of those two different communities is that they are very, very different in composition. They have very different needs in terms of populations. And actually, if you're going to get something right for a community, whether it's health delivery or physical activity, you've got to make sure that that is reflective of the community that's there. And I think some of those subtleties that David brought out in the report are very important. We remain very committed to work in place. So it's a decision we made 7 or 8 years ago. Those alliances very much feature organisations who are engaging in physical activity, because to go back to the point I made before, we very much believe in supporting the whole person, but we can't do that all ourselves. So working in good partnership, I think, is important in place. And then I suppose the last thing I would say is just on that challenge of how you make all of this so. And I suppose my big note of optimism in what I think can sometimes be quite a challenging mental health arena, where we know there are enormous gaps in terms of waiting lists and people trying to get support, is that the work that we have done in those alliances, David mentioned North East Links, Tower Hamlets, but we're also doing some work in Somerset, up in Coventry and Warwickshire, and Sheffield. What we're beginning to see now is data that's coming through precisely because you've got lots of organisations working in harmony together, supporting people wherever they come in. So they might come up in the system in a local gym or in a walking club or whatever it happens to be. Those alliances are now starting to very impressive data emerging. So big reductions, for example, in the number of people attending A&E. And I think that physical activity, being connected into your community, whether it's walking groups or whether it's being something much more intense, should remain, and I hope will become, part of those 3 big shifts that the Secretary of State wants to do, particularly from hospital to community. So I think we've got a chance to embed the importance of physical activity into the future health and social care system in a way that we haven't before. And I think that's in part due to all of the work that Sport England and lots of organisations on this call have done. And that for me is quite an exciting moment.
Thank you, Brian. That's great. Lovely to see so many questions coming into the Q&A section. So if you've got any more questions, please put them in. We will try and get through as many as possible. So I think what we might do is just move to some of those questions first. And maybe a first question, maybe more to Jeanette and then to Brian. A question about the type of exercise and activity that worked well with service users who have limited access to the community. Just from your experiences, either from generally or from the report, what would you say are the particular exercises or activity that worked well with service users who've got limited access, thinking about all the transport issues that have highlighted already?
Yeah, this is a hard question because it's so specific to the individual. But what I will say is the definition of exercise, movement, physical activity matters. So I think one of the biggest things that we have found in this work, but across other areas of work, is that there's this perception, and I think it is mentioned in the report, there's a kind of perception of the kind of formal offer of physical activity or sport. But the benefits of going from no movement to a little bit of movement, like a short walk around the block or some seated exercise for anyone with a long-term health condition, is incredible. So if you go from 0 minutes a day to 5 or 10 minutes a day, you will see a significant change, and that is evidenced. So I think what I would say is that for moving out of inactivity into inactivity, it's really important for individuals and communities to be kind to themselves and to start with small and to start with very accessible activities. We Are Undefeatable offers a whole range of stuff that you can do in your home as a starting point. But then when you start moving into the social connection space, which I think also comes out very strongly in this report and in other evidence that we have, there's something about having a connector. So I was really struck by the opportunity through the Tower Hamlets work to involve carers and how important it was for carers themselves to become active and then to become the companions for the people they're caring for in activity. So there's something about moving into that social connection space and having a connector that helps you to move through that. And then the other thing that I would say is in terms of sustaining activity, that again, that social connection is really important. So whereas not everyone is going to be thinking, I'm pumping iron, I'm doing lots of great exercise right now, but they will be thinking, I'm connecting with this person, I'm laughing, I'm enjoying myself, I want to do this again. And so recognizing the multiple layers of benefit of connecting is important. So, I mean, there probably are lots of activities listed in the report, but I think it's probably less about the activity itself and more about the definition of what it is to move your body on a regular basis and the social connection.
Thank you, Jeanette. Brian, did you want to make any comments on that one?
I'm not sure I could add anything to that. I think that was a brilliant answer. You might want to come to some of the other questions.
Yeah, okay. So one of the other questions is, did you experience any barriers with activity providers not feeling comfortable or being reluctant to welcome people with severe mental health challenges into their venues? So I wonder if Brian and David would like to comment on that one. And if so, were you able to overcome these? Any barriers that activity providers provide that stop people feeling comfortable?
Well, David will be closer to the actual research itself and then the views of people. I can say something general, but David, why don't you say something particular I can add?
I think there was a willingness on the part of the colleagues in leisure centres to actually change their practice. They wanted to do it better, but they didn't know quite how. So I think that was the first issue. The other thing to say that in Tower Hamlets, which was quite fortuitous, was it happened at this moment of history where they took the contract for their leisure provision back from an external provider and brought it back into the council, and so that was a moment at which they could redefine their outcomes and the way that they worked and what the kind of feel and nature and the purpose of the service was. and that was a really good opportunity to kind of reset a lot of these expectations and to support people to change their practice and to improve their understanding and awareness. What was the question? Have I answered the question, Julie? I feel like I've forgotten the question.
Just about the barriers that were placed by some of the providers. So people then felt not comfortable coming in. So were people reluctant to admit people with severe health challenges into their venues?
I didn't get that impression from the work that we did. I don't think I heard any stories like that. I think the issue was the getting over the doormat, getting into the building and getting in. That was it, and that they were psychological as much as physical barriers that people felt, some of which they felt came from the kind of culture of the organisation, but some of the things that they carried themselves.
So I think the thing that I would add to that, Julie, is this is where the issue of stigma is so important, isn't it? Because we're beginning to hear from certain bad actors out there in the public domain that we've come too far in mental health. But this is where the rubber really hits the road, I think, because I know for certain, and I could give a couple of examples of these, but I won't, that when I started in this job about 10 or 11 years ago, I heard of examples of organisations, of institutions, doing things that were just so stigmatizing because they had so little understanding of mental health and mental illness, and creating such egregious barriers for people. And I do think that's changed an enormous amount. I think that general level of literacy that now exists around the issue has made a big difference. And if I think about my own gym, for example, in South London, it very much represents the community that I live in, and it's brilliant to see. And you can tell that actually people from all backgrounds who faced all sorts of different challenges are in that. And that's partly because people don't have to show proof of a diagnosis that they have physical health condition like diabetes, or I can see there's a guy who's had a stroke, or indeed mental illness as well. And I've spoken to a couple of people who I know who do have a diagnosable condition. So things like that, and I agree with David's point about when you take those back into council use, that tends to happen a bit more. But the other part of stigma, of course, is self-stigma. And that question of, do I belong there? Will I be welcomed? Will there be people like me? Is, I think, the reason why organisations just have to go that bit further in terms of how they market themselves, how they speak about their offer, and how they describe what they are there for and who they are there for, in order to attract, as diverse a group of people and to overcome the stigma that people will sometimes put on themselves. And that's why I think that there's that change that we've had over the last 10, 12, 15 years around mental health and mental illness. This is where it really begins to bear fruit.
Brilliant, thank you. And a kind of connected question from Amy. She was asking about the carer training to be health influencers. Is there anything really taken forward from this? What's the next steps? Is this going to be a programme that's available to be delivered outside of Tower Hamlets, or are there any other future plans to roll this out? So just taking forward the lessons learned. Jeanette, do you want to say anything from Sport England point of view first?
Sorry, the mute thing wasn't working. So I don't know the answer to that very specific question. But what I was going to share in terms of current and future steps is that we have learned from this program how important carers are, and in parallel to this, we have been working with Carers UK on a program called Carers Active, and we're continuing to fund that over the next couple of years to kind of really train our focus on how carers can both benefit from physical activity and have barriers removed for them, but also be enablers for the people they care for. So I don't know the answer to the specific question about that bit of the programme, but I might kind of defer to others on that.
Yeah, Brian, I suppose what would you be able to take forward from this research and the pilot?
Well, I guess every time we do a piece of research with colleagues like this, and we understand how something's working effectively, we want to try to replicate that. So if I go back to that point about building alliances, we're just recruiting right now for a director of neighbourhood. I've got the job description in front of me right now, but it's effectively the continuation of expanding our alliance work. And I think because this is something that's obviously very important, because physical activity is such a key feature of our communities that care, I can very much see us looking to prioritise that in future alliances that we would run, because of course you've now got the obvious demonstrable benefits of it.
Thank you. I'm just very conscious of the time. I'm just wondering if a chance for everyone to say what they would like to see in terms of next steps. So what would be the next steps for organisations or calls to action, really, from people that have been involved in the whole process? David, would you want to sort of say anything first on that?
I think mine would be a methods point, really, which is start with co-production, keep the co-production going, keep it, sustain it throughout the project, throughout the whatever your local. I mean, it's really seductive for an evaluator to say these are the things you should do, but actually the whole point of the tenor of this was about saying you make suggestions to local people and work with them to find place-based, nuanced, appropriate responses for their families and their communities. So I would say the one thing that I think the one universal would be go co-pro, make the co-production really central to everything that you're doing. Okay,
and then I'm going to move to Brian next. If you could just be succinctly a kind of key points, next steps to take away.
Succinctly, that's not my bag, Julie.
Okay.
No, three really quick things. I mean, I think firstly the continuation of making the issue of physical activity something that is on the political radar of the people who are at the top of the system, commissioning service, sending signals down through local ICSs is important. I think that's been a hard-won battle, but I think we're starting to make progress, and I think we're just getting at the tipping point, so it's continuing to push that. I think secondly, completely agree with David, it's making sure that is place appropriate, because different communities need very different things. And the third thing, which is the same as David's other thing, is co-production. There's a big change going on in the system, and it's very brave, actually. The Secretary of State is trying to strip away a lot of the national targets that exist. And the hope, and the reason he's doing that, is because the hope is that local systems will design the health systems that they need for their populations. You won't get there without co-production, without involving people and helping to design. So I completely agree, co-productions will be the only way that we get there.
Brilliant. We do need that systems approach, don't we? Definitely. And Jeanette, I think I've only given you about 2 minutes maximum before we need to end the webinar for any final thoughts.
I agree with all that's gone before, so that's good. But the thing I wanted to highlight was that over the course of this work, there have been a number of reports that have added to the body of evidence around this work. And my call to action would be to use them as a body of evidence to inform practice at local and national policy level, because I'm sick of things being kind of created and put on shelves. So I think there's so much, like as you layer down into these reports, there is so much, and all the stuff that we have said is evidenced in those reports. So that would be my biggest call to action at this stage.
Thank you very much. And so a huge thank you to all our panelists, to Jeanette, to Brian and David. A huge thank you to everybody that's joined the webinar today. We will be making the webinar available. So if you found it really useful, do send the message out to everyone. We will try and answer your questions as a follow-up. There's lots of questions coming in today. Loving the energy, loving the enthusiasm. So yeah, I think key messages, whatever you can do, the smallest part of activity is really helpful to health. And we also know from wider research there's a great deal around health going out into nature as well. So even a small walk outside can be really, really beneficial. So huge thank you today for everyone that's joined, and just final farewells.